Special mention.
Yes, okay.
Special mention, Sri Mansukh Lal Mandavia. Those who want to read can read. Okay, you sit sometime. Sri Motilal Vora. Dr. KVP Ramachandra Rao. Arey, not person. Dekho, chalo.
Not present. Miss Renuka Chaudhary. Want to read it out?
I'll just speak, I can read it. Sir, there is an unprecedented crisis that is happening in the agrarian section in our country today. The entire Rabi season, this has been marked by absolutely unanticipated urea fertilizer crisis. The government did not have the vision or the will, it appears, to have enhanced
Kindly read out the text, please.
You just want me to read that?
Just read out. There's a special mention, you have just read out.
The government has not only failed to import the required quantity of urea
all other
for
things
this
will not go on
crucial
record,
season,
doing special mention.
but has also failed in providing necessary subsidy for domestic manufacturing of urea, resulting in large-scale resentment amongst farmers all over the country. The government has also failed to provide remunerative prices for farmers' crops by adding 50% of the profit to the cost in terms of the Swaminathan Commission report. The land acquisition ordinance has further added insult to the injury. Through this August House, sir, I urge the government to take immediate steps to resolve the burning issues of the farmers. This is absolutely crisis management is required at this point, and I urge the government to look at it. Thank you very much for a patient.
Thank you very much.
Thank you.
Mr. Vivek Gupta.
So with your permission, I would like to draw the attention of the House towards the number of pending cases, court cases that have crossed the 3 crore mark. Sir, in 2013, more than 63,000 cases were pending in the Supreme Court, registering a 9% rise since 2011. And the number of such cases continues to increase. Sir, over 2.6 crore cases are pending in district and subordinate courts and 44.6 lakhs pending in high courts, all waiting for justice. So despite the 15% increase in pending Supreme Court cases over the past 4 years, the central government's decision for closure of fast-track courts and the ceasing to fund fast-track courts has come as a blow to the state government. So West Bengal, our Honorable Chief Minister, Shri Mamata Bandyopadhyay, wrote a letter to the former Prime Minister and has also raised the matter with the centre regularly. So following this order, the number of functioning fast-track courts reduced by over 50%, and by 2011, the 1734 fast-tracks across the country had more or less wound up. After the Nirbhaya case, the central government said that the courts could continue till March 2015. However, at present, there are fewer than 900 fast-track courts in the country. In Delhi, 6 fast-track deal exclusively with cases of sexual assault. As of April this year, 1,374 cases were pending in these courts. So there are 258 vacancies of judges alone in the Supreme Court, along with 4,700 vacant judicial positions in Supreme Courts and High Courts that are fueling the injustice borne by the victims. Sir, Calcutta High Court has registered a 19% decline over the past 3 years in pending court cases. Yet several cases filed still await justice before the law. A move in this direction would be establishing a permanent bench of the Supreme Court in Calcutta, giving much relief to the citizens of this part of the country. I urge the government to take stringent, effective and immediate measures in addressing the situation that is growing in magnitude in the country. After all, justice delayed is justice dead. Thank you, sir.
Thank you. Srimati Kanaklata Singh, please.
Not present.
No. Srimati Kanaklata present, not present. Sri Palwai Govardhan Reddy.
Sir, request Government of India to open Jan Aushadhi stores in every primary health center and all government hospitals. We have over the years developed a strong capability in producing quality branded and generic medicines by going up from mere 1,500 crores industry in 1980 to a more than 1,30,000 crores industry in 2014, sir. Although these medicines are reasonably priced as compared to prices of their equivalent medicines in most other countries, yet a large population of poor people in the country find it difficult to afford medicines. Accordingly, for ensuring availability of quality medicines at affordable prices to all. Government started Jan Aushadhi scheme. Initially, it started to set up 170 Jan Aushadhi stores in various parts of the country, including 2 in Telangana, 1 in NIMS, and 1 in Uppal, and 1 in Andhra Pradesh. But out of these, only 89 are functional. The main problem that these stores are facing is relating to the availability of the medicines. Out of 361 medicines proposed for supply, only 200 are available. Secondly, there are extremely limited stores in the country. How can it be successful if we have 2 stores in Telangana for 4 crores population and 1 store in AP for nearly 5 crores population? I understand the government is proposing to open 3,000 Jan Aushadhi stores in various parts of the country in 12th plan. But even after completion of 2 years of 12th plan, targeted Jan Aushadhi shops were not being set up. So I strongly feel that government should provide separate budgetary allocation and take steps to open Jan Aushadhi in every primary health center. Only then objective of providing medicines at affordable price to poor can be achieved. Thank you.
Thank you very much. Ms. Vijala Satyanand.
I wanted to bring to the notice of the Government of India on the pathetic situation of the Central Hospital in Mukkudal, Tirunelveli district, Tamil Nadu. 30-bedded Central Hospital Mukkudal opened to cater to the needs of the BD workers in Tirunelveli district, Tamil Nadu. More than 10 crores were spent by the central government for building and infrastructure. Lot of equipments were purchased and operation theatre was established. Earlier there was a thought of upgrading it to 50-bedded hospital. But now there is a declining trend, and at present the functioning of the hospital is paralyzed as mentioned below. The first one is 3 to 4 years back, daily 1,000 patients were treated. But the present situation is hardly 150 patients are treated. And 3 to 4 years back, all the 30 beds were full and extra beds were provided. But now the present situation is no inpatients are admitted. 3 to 4 years back, with meager amount of rupees 30 per patient as diet charges, foods were served 3 times to the inpatients admitted. But now the present situation is diet charges increased to rupees 50, but inpatients are not admitted and hence foods are not provided. Kitchen closed. And 3 to 4 years back, the hospital was running 24 hours, but now hardly for 6 hours. The 3 to 4 years back, patients were admitted in the hospital, and according to necessity, patients were sent to the government hospital Tirunelveli and Madurai through ambulance. But now is kept idle. 3 to 4 years back, scan and ECG was taken, but now the scan ECG machines are not used. 3 to 4 years back, medical officer and the staff pattern was there, but now there is no change in the officers. And the reason for this is ineffective supervision by the welfare commissioner and non-committed medical officers and staff. I therefore demand that biometric machine to be installed immediately to regulate the attendance of medical officer and staff. Efforts should be taken to run the hospital for 24 hours, because all the major employment opportunity is only BD workers in Tirunelveli. Sufficient medicines to be supplied and inpatients to be admitted. A committee to be constituted by the ministry to study the performance of the hospital and to initiate disciplinary action against the medical officers who hardly attends the hospital and officials responsible for non-functioning of the hospital. Thank you.
Thank you. Mr. Bhupender Singh? Not present. So the House stands adjourned till 11 a.m. on Wednesday, the 25th of February 2015.